Insomnia is a sleep disorder. People with insomnia have trouble sleeping, difficulty falling asleep, or staying asleep as long as desired. While the term is sometimes used to describe a disorder as diagnosed by polysomnographic or actigraphic evidence, this is often practically defined as a positive response to either of two questions: do you experience difficulty sleeping? Or do you have difficulty falling or staying asleep? Insomnia is most often thought of as both a medical sign and a symptom that can accompany several sleep, medical, and psychiatric disorders characterized by a long-term difficulty falling asleep and/or staying asleep or sleep of poor quality. Insomnia is typically followed by functional impairment while awake. Insomnia can occur at any age, but it is particularly common in the elderly. Insomnia can be short-term, up to 3 weeks, or long-term, above 3-4 weeks. It can lead to memory problems, depression, irritability, and an increased risk of heart disease and automobile-related accidents. Insomnia can be grouped into primary and secondary insomnia. Primary insomnia is a sleep disorder not due to a medical, psychiatric, or environmental cause. It is described as a complaint of prolonged sleep onset latency, disturbance of sleep maintenance, or the experience of non-refreshing sleep. Conditions that can result in insomnia include depression, pain, benign prostatic hypertrophy, obstructive sleep apnea, and restless leg syndrome, and substance misuse. A diagnosis will differentiate between primary insomnia, insomnia as secondary to another condition, and primary insomnia comorbid with one or more conditions. Cognitive behavioral therapy is useful in insomnia that is present for a long duration and is recommended as the initial treatment. Those who are having trouble sleeping may use sleeping pills, which may help, but also may lead to substance dependency or addiction, and long-term worsening of sleep, if used regularly for an extended period. Medications are not recommended for more than 4 or 5 weeks. Symptoms of insomnia can be caused by or be associated with use of psychoactive drugs including certain medications, herbs, caffeine, nicotine, cocaine, amphetamines, or excessive alcohol intake. Use of or withdrawal from pain relievers such as opioids. Previous thoracic surgery. Heart disease. Restless leg syndrome, which can cause sleep-onset insomnia due to the discomforting sensations felt and the need to move the legs or other body parts to relieve these sensations. Hormone shifts such as those that precede menstruation and those during menopause. Life events such as fear, stress, anxiety, emotional or mental tension, work problems, financial stress, birth of a child and bereavement. Mental disorders such as bipolar disorder, clinical depression, generalized anxiety disorder, post-traumatic stress disorder, schizophrenia, obsessive-compulsive disorder, dementia, and ADHD. Medical conditions such as hyperthyroidism and rheumatoid arthritis. Abuse of over-the-counter or prescription sleep aids, sedative or depressant drugs, can produce rebound insomnia. Poor sleep hygiene, for example, noise or overconsumption of caffeine. Physical exercise. Exercise-induced insomnia is common in athletes in the form of prolonged sleep onset latency,